Call to order the meeting of the Social Services Committee. And first thing is approving previous minutes.
Motion.
Motion, Mr. Camiso. Second, Mr. Reinhardt. All in favor? Opposed? Okay, passed unanimous. On the current business, number 1 on the agenda is authorizing an agreement with Children's Health Home of Upstate New York regarding Medicaid care management services for the children.
Yes, good evening, everyone. So the department would like to request legislative authorization to contract with CHUNY, the Children's Health Home of Upstate New York, for the provision of care management services. Our Children's Mental Health Clinic is designated as a provider of care management agencies, and in essence entails the coordination of services for youth that meet the designation for care management. And during the time that we've been providing these services, we have seen an increase in the revenue based on the capacity and the managing of the caseload. So we'd like to request authorizations to continue to have that contract with CHUNY to continue to facilitate these services.
Thank you. Are there any questions from the committee? Hearing none.
Motion.
Approved. Mr. Camiso, second. Mr. Reinhardt, all in favor? Opposed? Passed unanimous. Okay, number 2 on the agenda, authorizing agreement with foster care agencies regarding the Raise the Age initiative.
Yes, so I believe, as you are all aware, Raise the Age was implemented in New York State in October 1st of 2018. And along with that implementation, there were agencies that were designated to provide Raise the Age services for those youth that are in need of placement services. So there were programs that were licensed by the Office of Children and Family Services specifically for the provision of these services, which are listed as part of the backup documentation provided with the RLA. So we'd like to request authorization to contract with these agencies, so if there is a need to place a Raise the Age youth, we are able to do so.
Okay, thank you. Are there any questions from the committee? Ms. Lockhart?
Commissioner, none of these are local, huh? They're all-
No, the closest is Northeast, and they are only licensed for females. And then if we have any males, we're looking at William George, so we still try to utilize the ones that are closest, but the males, we have none in the immediate region.
because they have to be brought back and forth to family court and stuff periodically, right?
Right, and so, that's part of what is required in terms of the provision of their services, facilitating that transportation. It really has an impact when it comes to doing the reentry work, the reintegration,
Yes,
and
yeah.
facilitating family contact. That's where we're finding that some of the challenges lie, but in addition to the state aid rate that they receive for the provision of the room and board, they also receive an additional rate for facilitating those services. So the idea is for them to build a network to
Right.
facilitate those reentry services.
Do you know why there aren't any closer? Why there's not?
The state issued an RFA, and it really was
Okay.
up to agencies to decide whether or not they wanted to respond. And so what we have here, I don't know that it reflects everyone that responded, but it reflects everyone that the state actually approved.
Okay, thank you.
Thank you. Are there any other questions from the committee? Motion to approve. Mr. Bullock, second. Mr. Camiso, all in favor?
Aye.
Opposed? Passed unanimous. Number 3 on the agenda, amending resolution number 504 for 2018 regarding foster care providers.
Yes, so the need for this is that NAFI, North American Family Institute, has restructured, and so in terms of their parent company, they are no longer in the New York region, and they have relocated to a subsidiary in Connecticut. And when it comes to the contracting of services, we have to be very specific that the name aligns with the agency that we're utilizing. As such, this is the request to add this, now that they are at NAFI Connecticut, to our list of providers, so we're able to utilize them when needed. Just as a note, even though their parent company is, the subsidiaries in Connecticut, their foster homes are still in New York State.
Okay, thank you. Are there any questions from the committee? Hearing none, can I get a motion to approve? Mr. Reinhardt? Anyone second? Second, Misso, all in favor? Aye. Opposed? Passed unanimous. Okay, number 4 on the agenda, authorizing agreements regarding the Children's Advocacy Center and amending the 2019 Department for Children, Youth, and Families budget.
Yes, so the Children's Advocacy Center is where our reports of sexual abuse and serious physical abuse are investigated. The idea behind the Children's Advocacy Center is really to minimize any additional trauma to children who have experienced this serious level of abuse. And so it's really having a multidisciplinary team that's represented with persons from our department, law enforcement, the DA's office, the medical, the coroners, and really being able to have a really unified approach to be able to investigate these cases and again, limit the number of times that a child will have to talk about whatever trauma that they have experienced.
Thank you. Are there any questions from the committee?
We'll make a motion.
Motion, Ms. Lockhart, second. Mr. Clay, all in favor? Aye. Opposed? Passed unanimous. Number 5, authorizing an agreement with the City of Albany Police Department regarding a part-time law enforcement coordinator for the Children's Advocacy Center.
Yes, so interrelated with the previous RLA, as part of our ongoing efforts to be able to have as comprehensive as an MDT team as possible and to have the input required from the various members, we've identified that having a law enforcement coordinator is of benefit because they are able to utilize the connections that they have with various law enforcement agencies and able to really facilitate having that additional and increased involvement with the CAC, if you will. And so for this contract year, it will be APD, which was the contracted entity for the previous year, so we'll be able to build on the work that they've done so far.
Okay, great. Any questions from the committee? Ms. Lockhart?
Commissioner, they still rotate between police departments?
We
You're
still
doing
do
that?
rotate. I will say this is the first time that we've had a repeat.
Yeah, that's what I was curious.
We made inquiries to other departments, but we didn't have any takers, so that's something that we're going to be working on for next year to continue to have the rotating. But I will say that, you know, one of the things that we thought about is maybe it makes sense to do it on a 2-year as opposed to a year, because it gives really time for the person, whoever is in that role, to really have, you know, a 2-year period to develop those relationships. So it's something to think about.
Thank you.
Just to follow up on that last point you made, which I think is a very good one, how does that get implemented?
In terms
To
of...
go to the 2-year, is that something you administratively do?
Yeah,
or-
we would do that. Just instead of issuing, you know, reaching out on an annual basis, we would
No,
just
no,
do it.
I think what you just said makes a lot of sense.
Right.
Mr. Clay?
Commissioner, is that position is a full-time police officer? Is that what?
No.
Who is the coordinator?
It's actually someone who is employed full-time by the department, and this is just additionally what they're doing to their other duties, if you will.
Thank you.
Are there any other questions from the committee?
Make a motion.
Motion approved, Ms. Lockhart. Second, Mr. Reinhardt, all in favor? Aye. Opposed? Passed unanimous. Okay, number 6 on the agenda, authorizing the submission of a supervision and treatment services for juveniles program plan to the New York State Office of Children and Family Services.
Yes, so OCFS has a pot of funding called the STSJP, which counties are able to utilize to develop programs for juvenile justice prevention. And so this is a funding stream that Albany County has been utilizing for the past number of years, and it helps to support programs such as the Juvenile Reporting and Family Center, the Juvenile Accountability Board, which is a restorative practice, as well as being able to have some programs internally to really look at how do we continue to develop programs and services to support those youth that are interfacing with the juvenile justice system in order to mitigate them further penetrating into the system and going into detention and/or placement.
Thank you. And are there any questions from the committee? Motion approved. Mr. Commisso, second, Mr. Clay, all in favor?
Aye.
Opposed? Passed unanimous. And last item on the agenda, number 7, authorizing the acceptance of enhanced funding from an agreement with the New York State Office of Children and Family Services regarding mediation services for persons in need of supervision.
Yes, so interrelated with the previous RLA, with this year's STSJP funding, OCFS released an additional funding, a pot of funding, just a one-time allocation, because with the impending PINS legislation, which takes effect as of January 1st, 2020, where PINS youth can no longer be remanded to detention, as well as there are other some changes related to placement strategies and options that are available for PINS youth, and recognizing the impact that this has on counties, OCFS did allocate, like I said, a one-time funding to be able to, for counties to be able to look at how to respond to that and to build in some strategies in regards to that. So with the funding that we have been allotted, we've identified being able to allocate it towards engaging a youth peer support. With the STSJP plan, we're going to be RFPing parent partner services, because the research shows that being able to have someone who has interfaced with these systems and be a liaison to parents does help in terms of engagement. And so having the parent partner for the parent, and then having a youth engagement specialist for youth, the idea is to be able to bring everyone to the table, and each party, if you will, feeling that they have someone there to support them, and really being able to mediate whatever the circumstances were that brought them to this place, and hopefully being able to identify some positive solutions.
Thank you.
Just to clarify, so that mediation is between the parents on the one side and the child on the other?
Yes, so it really is, when we look at our PINS data, a lot of our PINS youth are either runaways or truancies, and so we're really looking at how to be able to, and usually we find the communication between the parent and the child has really broken down, and so we're hoping with this sort of a strategy that we're able to create a neutral environment, if you will, where there's no power dynamic that seems to be imbalanced, because each party has someone there that is representing their interest, if you will. Those persons are still neutral, but it's the idea of being able to create a sense of support and being able to facilitate a neutral environment to hopefully get to a resolution.
And presumably on both sides of the table now, you have people who are expert in mediation.
Oh, absolutely.
Yeah.
Yes, absolutely.
Are there any other questions from the committee? Okay, hearing none, motion to approve. Mr. Reinhardt, second. Ms. Lockhart, all in favor?
Aye.
Opposed? Passed unanimous.
Thank you. Have a wonderful Thanksgiving, everyone.
Thank you.
And motion to adjourn. Mr. Reinhardt, second. Mr. Kniss, all in favor? Opposed? Meeting is adjourned.